So how has the trends changed over the years with treating these specific?
Question, Jarvis. Look at you. So, women were afraid of hormones for a while. So back in 2000, they did this big study. They call it the Women's Health Initiative study. And in that study, that's when women were taking estrogen and progesterone. They were not even taking the testosterone. And they were taking the synthetic made from horse urine that you write a prescription for. And a lot of those women were noted to have an increased risk of heart disease, stroke, blood clots, and breast cancer. That study showed those numbers, but once they went back and reviewed the study, they realized that it was a little exaggerated. The risks weren't as high as they thought they were. So what they did was they told all women, just get off hormones. So all of these women who had been feeling better with hormones, they just yanked them off and let them suffer through. And so I went and did the research because I realized that what I was taught in medical school and residency just wasn't working. Like if my patients were feeling bad with all of these symptoms, giving them estrogen and progesterone didn't help. It was really that testosterone. So I went to figure out what could help my patients. I learned about testosterone, the plant-based bioidentical, and I started using the cream forms. And then I found a great company that I was trained with to do the plant-based bioidentical hormone pellets. And they work so much better. They're long-acting. People feel better. They decrease the risk of heart disease, decrease the risk of breast cancer. Testosterone pellets do decrease the risk of dementia as well as bone loss. So they actually help improve health as well as quality of life.
And I know women are watching. Why this man want to know so much about it? Well, you want to know this so you won't think it's you. It's something going on with them.
That's right.
Now, even with the man, you know, I guess I get real.
But men get irritable too. They go through that whole andropause.
Yes. They get irritable. And then what I was thinking while you was talking about all day is sometimes men, they'll pop the blue pill, and the blue pill have all those side effects too. Where they have a headache.
Their heart. It can affect their heart, and it can make it where they can't get rid of what they were trying to get. So instead of the blue pill, most of my male patients, first of all, we check their hormone levels, make sure they're balanced. If they're not, we give them the plant-based bioidentical testosterone, get their levels up, they're feeling better. And then if they're still having function issues, because 50% of men at 50 are going to notice a change in their erections. That's just a part of life. The same way women are going to notice a change in their vaginal tissue. They're going to notice more dryness. So we can fix that with our intimacy services. So we have the P shot for men, the O shot for women. We have a wave machine that increases the blood flow, improves erections for men, improves sensitivity, enjoyment, the big O for everybody. And then for women, it even helps with urinary symptoms that a lot of women notice as they continue to age and mature, like leakage of urine or more urinary tract infections.
Now, forgive me, but I know a couple of years ago you asked me about this type of service you do. I'm gonna call it, instead of saying the V word, you renovate the house.
Yes, and that's what the O shot does.
Okay,
so the O shot is like rejuvenation of the vajayjay.
Yeah.
And what that does is, as women age, they notice more dryness because of the hormonal changes. But they also notice a change in the tissue where the vaginal tissue becomes thinner. It's not as sensitive. It can be uncomfortable to have intercourse, and it can be very difficult to enjoy intercourse like they did before. So by doing the O shot, once every 12 to 18 months, that keeps the tissue healthy, lubricated, and orgasmic.
So they don't have to go buy all that jelly from the stuff.
We don't do that. And then I also teach my ladies to treat the tissue before it's a problem. So now if you're 40, I recommend you do put something in vaginally twice a week to decrease the chance of what I call old lady vajayjay. We're not doing that at Mibella. We treat the tissue, maintain healthy tissue just like we do with our face. You have to give it some extra attention as you age to get rid of the wrinkles. You have to do the same thing for the vaginal area. And then for men, we have those same wonderful services so that they don't have to suffer through erectile dissatisfaction.
Because like I know some women probably watching this too. I just had that kid. Does that
Yes. So after having a baby, they may notice a change in the laxity of the tissue, so it may not be as tight as before, and they may notice more leakage of urine with coughing, sneezing, jumping, laughing, or urgency and frequency. So those procedures will get rid of those symptoms and still improve their function and enjoyment.
So what's the average, I know, sit down for initial consultation, once you start the treatments, how, I mean, I know some people probably come for ongoing treatments, but is it normal, like 3 to 6 months normal?
Good question. So for the pellets, usually for women, they're going to get their pellets every 3 to 4 months.
Okay.
For men, they're going to need their pellets every 5 to 6 months. So the pellets last for a while. A lot of the intimacy services for the men, it depends on what's going on. So a man who's had prostate cancer, had his prostate removed, we can still do those services to help him to continue to be able to enjoy intimacy. So he's going to need more procedures than somebody who's just turning 48, 49, noticing some small changes, and they want to do procedures to make sure that they don't go down that road at all with erectile dissatisfaction. So it's going to be individualized treatment for the pellets as well as the intimacy services, and even our weight management and gynecology. We try to individualize treatment so that everybody gets exactly what they need based on them and their genetics and their lifestyle.
Do you offer meal plan suggestions?
Yeah, so with our weight management, we separate ourselves because we were all trained on weight management. So me and my nurse practitioner who does the weight management here, we went through the Center for Medical Weight Loss so we can learn how to teach our patients to really lose the weight the right way. So they come in, do a consult, they come in fasting, breathe in a machine, and then it tells me your resting metabolic rate. So I know your resting metabolic rate is, for example, 2,200. That means that if you eat 2,200 calories every day, you will not gain weight. If you eat 2,000 calories every day, you're going to lose weight. And then it helps us with your eating plan to design one. And everybody is pretty similar. You're going to need your healthy protein because over 35, you're fighting for that muscle. So you need healthy protein. You need good resistance training. You need your cardio activity. And you need to eat healthy food and frequent small meals instead of eating 1 or 2 big meals a day.
Now, one thing that just came in my head is, do you do supplements, vitamins? Yeah,
so we have a supplement line. I love our supplement line. And I started this supplement line because I had patients who needed supplements, and I would say, well, go get omega-3 or go get this, and they would just go to Walmart, grab it off the shelf, and it was a lot of fillers in there, and it wasn't necessarily the products that I needed in there to really supplement their nutrition. So with this line, it was made by naturopathic doctors. It's called Ageless Balance with Dr. Mia. So I know they're getting high quality supplements that have been tested and verified, and they're safe and effective, and a lot of them are actually vegan, so my vegans can do the supplements and not be worried about having some kind of form of meat or animal product.
Now, I'm glad you brought that up. So when they bring those hamburgers, the plant-based hamburger, are those healthy to eat? In your professional opinion?
I'm not into a lot of processed food. I believe that God put on the earth what we should eat. So I like my lean protein. I like my fruits and vegetables, and I try to eat as much whole food as possible, and I find that that works best. I think when you get into a lot of processed food, they're putting some extra stuff in there and you don't quite know what it is. So you would really have to verify the ingredients. But for me, I just like to eat the regular food that God put on the earth, including the animals. But some people want to avoid that, so they do have to come up with creative ways to get the protein in for the muscle mass.
So is that the difference between coconut milk and real milk?
It is.
So cow milk.
Yeah, so cow milk is dairy.
Okay.
And so some people like to avoid dairy. They feel like it increases mucus and that dairy is no longer healthy. I personally am lactose intolerant, so I do a lot of almond milk or oat milk if I'm going to do milk. I can't do regular milk, and a lot of people can't. But I think, and then if I cook, I'll still get regular milk to cook with. I just try to get the organic, like I try to get the organic meats because I feel like they're healthier and they don't upset my stomach as much. They're not as processed, and I actually stay full longer when I eat healthy, lean protein, high quality, organic. I don't have to eat as much of it to be satisfied and full compared to if I go to a fast food restaurant. I'm going to be hungry in 2 or 3 hours.
Do you know what's happening in Birmingham? Download the What's Happening Birmingham app today on Android, iPhone, and iPad for free. Get info on everything you need to know about local news, events, businesses, restaurants, and more. Visit our website, what'shappeningbham.com, or follow us on social media @happeningbham for more information. Download the What's Happening Birmingham app today, your source for everything Birmingham.